What's up everyone? While the well-known symptoms of vitamin D deficiency are pretty obvious, like bone pain and frequent illness, there are actually dozens more subtle and surprising ways low vitamin D status can manifest. In today's very comprehensive video, I'm going to thoroughly cover over 20 weird, lesser-known symptoms and health conditions that can arise from vitamin D deficiency. Understanding the extensive impacts vitamin D has on immunity, inflammation, hormones, mood, metabolism and many other processes explains how deficiencies create issues throughout the body. There are some really fascinating connections here that you likely never realized were linked to low D levels. I'll also discuss the science and research associating vitamin D with each one. There's a ton of important info here, so make sure to stick around until the end to get the full overview. Okay, let's dive in. Well-known symptoms of vitamin D deficiency. First, the common textbook symptoms of vitamin D deficiency include bone and joint pain, frequent fractures from reduced calcium absorption and bone turnover, muscle weakness, pain and atrophy from vitamin D's roles in protein synthesis, impaired immunity with more colds, flu and infections. Vitamin D regulates immune cell function. Low mood, depression and seasonal affective disorder. Vitamin D influences serotonin. Fatigue and tiredness. Vitamin D supports energy metabolism. High blood pressure. Vitamin D helps regulate blood pressure through several mechanisms. Worsening asthma. Vitamin D dampens airway inflammation and immune overactivity. Poor sleep quality. Vitamin D regulates circadian rhythms and deep sleep stages. Those are the well-established signs of vitamin D deficiency that most people associate the condition with. But vitamin D actually impacts virtually every cell and system in the body. It's involved in thousands of metabolic processes and gene activations. So deficiencies can manifest in many other subtle yet detrimental ways beyond just the obvious musculoskeletal and immune effects. Let's explore some of the most surprising associations that research has uncovered. Lesser-known symptoms of vitamin D deficiency. Nightmares and vivid dreams. 1. Vitamin D regulates production of serotonins and acetylcholine involved in sleep cycles and dreaming. 1. Deficiencies can impair sleep quality and cause vivid nightmares. Restless leg syndrome. 1. Low D is linked to restless legs, likely through effects on dopamine levels and inflammation regulation in the nervous system. Worsening acne. 1. Vitamin D demonstrates antibacterial effects and immune balancing properties that help calm the inflammatory immune overactivity driving acne. Mood disorders like bipolar. 1. Low vitamin D is very common in mood disorders including bipolar and schizophrenia. 1. Vitamin D is deeply involved in neurotransmitter synthesis and neural function. Irregular heart rhythms. 1. Vitamin D regulates calcium and electrolyte levels critical for normal cardiac conduction. 1. Deficiencies promote arrhythmias like atrial fibrillation. Impaired breathing patterns. 1. D strengthens respiratory muscles and immune defenses against lung infections that disturb breathing. 1. Low D also associated with asthma attacks. Skin disorders like psoriasis. 1. By modulating the immune system and inflammation, vitamin D improves numerous inflammatory skin conditions and autoimmune disorders. Chronic sinusitis. 1. Vitamin D bolsters immunity against the bacteria and viruses causing secondary sinus infections and congestion that becomes chronic. Developmental issues in children. 1. Vitamin D deficiency while pregnant or during childhood bone development can contribute to altered growth, spine curvature and dental malformations. Recurrent tonsillitis. 1. Vitamin D activates innate antimicrobial immunity and antibodies to combat throat infections before they become recurrent and chronic. Heavy menstrual bleeding. 1. Vitamin D regulates hormones, inflammation and immune factors influencing menstrual cycles. 1. Deficiencies are linked to abnormal uterine bleeding. Urinary incontinence. 1. Vitamin D deficiency weakens pelvic floor muscles involved in bladder control. 1. Supplementation improves stress incontinence. Chronic fatigue. 1. Vitamin D cofactors ATP production and stimulates muscle protein synthesis involved in maintaining energy levels and preventing exhaustion. Early puberty onset. 1. Low vitamin D can contribute to premature puberty, as it helps regulate sex hormone balance and gene transcription. Progressive muscle loss. 1. By stimulating muscle cell growth and inhibiting myopathy, vitamin D protects against age-related sarcopenia muscle wasting. Eye disorders. 1. Vitamin D promotes ocular health by reducing inflammation, pressure and fluid buildup involved in macular degeneration, glaucoma and myopia. Erectile dysfunction. 1. Vitamin D enhances nitric oxide signaling critical for healthy endothelial function and blood flow involved in sexual response. As you can see, the extensive roles vitamin D plays in modulating immunity, inflammation, hormone equilibrium, neuromuscular function, respiratory health and tissue growth explains how deficiencies generate such diverse manifestations. Optimizing your vitamin D levels provides protection against this broad array of negative effects by supporting whole-body homeostasis. Get your levels tested and use sun exposure, food sources and targeted supplementation to maintain optimal range between 50–80 nanograms per milliliter year-round. Let me know if you have any other questions about the widespread benefits of vitamin D and overcoming deficiencies. Wishing you perfect health.